The difference between our abductor presses, which are part of the Function First exercise programming, and say abduction that's done with a mini band, similar how you might see in monster walks, but people also do it using a band when they're doing glute bridges or even just laying on the floor. There is a distinct difference, and both of them have their purposes. One obviously involves a dynamic motion of the knees going out, and the abductor presses that we do are more isometric. And one of the main differences between the two and why the abductor presses in our program are used when they are used is because if you look at this hip joint here, and this is my pelvis that probably has more frequent flyer miles than most international salespeople, but it still holds up for me enough for some of this. So when our hip thigh bone goes out in abduction, we get this kind of motion where the ball turns both out, or I should say in, but then it glides a little bit inferiorly or down. And so when we're not moving against a strap or an irresistible force, which would be the strap or if somebody's hands were there, when we push, we still get a little bit of this roll and glide in the joint. In other words, the force is trying to go somewhere. So because the leg and the thigh bone, the femur here, is not moving, we get another response, which is also back here at the sacroiliac joint. And the sacroiliac joint arguably has very little motion. Most people feel that way, but there's some. And it's maintained stability-wise through ligaments predominantly. And what we get is a little bit of distraction or a little bit of separation back here that may help the body find its true north back there, or help what we would say mobilize the joint a little bit. So we get a positive influence. That's why many of you feel that you describe that you feel it in your lower back when you're doing this exercise. So instead of getting this motion that we would get if we were using a mini band or pressing out against a machine and doing that, instead the thigh bones remain. What we do is pre-position it with your thighs closer together, or we call that adducted, where they're coming towards the midline. And then we're still getting a little bit of this roll and glide in here. So we're still stimulating the joint a little bit, but predominantly what we're doing is an isometric contraction, which gets these outer thigh muscles here, the glute medius predominantly, a little bit of the glute minimus, maybe a little bit of the posterior fibers of the glute maximus, but the muscles that control a lot of motion in this side to side are frontal plane. And by doing that, what we are doing is creating a limited or an isometric contraction, again, where there's limited motion, but that really helps the body flood those muscles, or those little engines in the muscles that we call motor units, really helps flood them and excite more of them than we might get in a more dynamic movement, which is why we do it early in the program. It's a level A exercise in our description of things, and that allows the body to kind of do a better job at recruiting those muscles, so that then we can do more advanced exercises where the body's more vertical, a little bit more dynamic, etc. So we set the table with something like this, and that's the difference between our abductor presses against an irresistible band and something that is a little bit more dynamic using a mini band or machine where the thigh bones go out. Hope that's helpful.